Hello and welcome to our 2-Minute EBP Challenge. This is David Woodruff. I'm the president of Ed for Nurses, where we empower nurses to become extraordinary. Join us online by going to www.edfornurses.com. This program is part of our 2-Minute EBP Challenge. An email comes out every Friday into your email box with our question, and the answer comes on Monday. You can subscribe to the 2-Minute EBP Challenge by going to www.edfornurses.com. This week's question is talking about postoperative pain. What they found in a recent Cochrane review, meta-analysis, was that there was a 50% reduction in pain relief within 4 to 6 hours in only about 30% of patients who received short-duration drugs. However, about 70% of patients had a 50% reduction in their postoperative pain when we used longer duration drugs. So certainly this is one of the considerations you might want to think about when you're planning the appropriate type of pain relief for your patient. The other thing that they found that is very interesting in their study was that no one drug achieves pain control in every patient. Therefore, we need to be looking for what drug is going to work best for this particular patient. So we tried one, it's not really working particularly well for our patient, well then maybe we need to try to use a different one. So that certainly would be something that we'd want to consider. So certainly keep that in mind. That is definitely something that you'd want to consider if we're going to be using different medications for different patients, because it's not always the same drug that's going to work well. So what are some of the options and what worked well? Nonsteroidal anti-inflammatories seem to work fairly well across the board. Nonsteroidal anti-inflammatories, as the name implies, are medications that have anti-inflammatory actions, much like you might see with a steroid medication. However, they're not steroids, so we don't have all those bad side effects we get with steroids. So steroids can cause a high blood glucose in your patient. It can cause problems with fat distribution in the body. All sorts of complications can occur as a result of using a steroid. Non-steroidal anti-inflammatories, these are medications that you are probably very familiar with. You use them all the time. You see them used all the time. Ibuprofen being one of the common ones. And again, if you're going to be asking your patient about whether or not they use these medications, it's often helpful to be able to kind of run down the list with them, because people don't even see these as being drugs anymore. They just consider, hey, I got it at the grocery store, so it's not even a medication. This is just a non-aspirin pain reliever, okay? But these medications are pain relievers, and they do have some side effects that we need to be aware of. However, they are fairly good medications for mild to moderate pain. Typically, they're going to be prescribed for these kinds of mild to moderate pain, but can be very helpful also in postoperative pain. Some of our NSAIDs have a fairly long duration of action. Ibuprofen's a fairly short duration of action, but some of the other ones have a very long duration of action. And what they found in this study was that the longer duration of action of NSAIDs tended to help reduce pain in our patients better than the shorter duration of action that occurred with many of our other medications, including some of our narcotics. As I mentioned, there are side effects associated with NSAIDs. These include gastrointestinal side effects. This is probably one of the most commonly written about and most commonly experienced side effects that we see. GI side effects. The worst of which could happen would be GI bleeding in your patient. So we really want to be watching for the patient having abdominal pain, stomach pain, maybe some gastric reflux, heartburn kind of pain when the patient is receiving NSAIDs, because that could be a clue that maybe the patient could be developing gastrointestinal bleeding, or at least on the way to eroding that gastric mucosa, which could lead the patient to eventually end up bleeding. Also, renal side effects. Now, renal side effects are usually caused by long-term duration of the use of these medications. So certainly in a postoperative setting, we don't really have to worry so much about some of these other things. There was a study a few years ago that looked at the renal side effects in postoperative patients, and what they found was that patients actually had decreased urine output in the short term while they were receiving NSAIDs. However, that urine output increased again and went right back up to normal normal where it should be as soon as the NSAID was stopped. So it was not a long-term duration of alteration in effect with that. So it wasn't a big deal there. Okay, photosensitivity is another possibility, and cardiovascular side effects that we've talked about in previous videos. So what else can we add to the mix? Oxycodone was also found to be a fairly good drug in helping to prevent postoperative pain and did provide pretty good postoperative pain relief for our patients. Oxycodone is an opioid analgesic. It's commonly going to be combined with other medications that help to increase the effect that we get. So they commonly are going to put it together with nonsteroidal anti-inflammatories. In the United States, the most common one is going to be acetaminophen. It's used for moderate to severe pain. So your patient's having a little bit more severe pain. Now we're going to move into something like this. The common drugs that we see in our practice in the United States would be Tylox, Percocet, and then the extended release version, which is Oxycontin. So these are the more commonly used ones that we would see on a regular basis here in the United States. Side effects of oxycodone. Okay, now you saw the side effects of the nonsteroidal anti-inflammatories, and they seem like, well, they got a lot of side effects associated with them. Well, look at this. Holy cow. So we got a lot of side effects associated with OxyContin. We're really going to have to be kind of aware of that as we're dealing with our patients. So certainly there can be adverse reactions like skin reactions. There can be central nervous system reactions. This is a narcotic, and so we can have a lot of our central nervous system type of problems associated with it as well. So as you go around and look at these different side effects, these are things that are going to be a major problem for your postoperative patient. Keeping in mind that postoperatively, we want our patients to be able to cough, deep breathe, incentive spirometry. We want to be able to open up those lungs and use those lungs. Well, okay, narcotics are going to cause slowed breathing, decreased respiration, so that's not going to be helpful. It's also going to tend to cause constipation, which can also be kind of a problem in our postoperative patients. So there are some side effects associated with it. There was better pain relief. So our nursing considerations would be, first of all, we want to assess that patient for their pain level, and we want to continually reassess. We gave them the pain medication. The medication was not successful. Rather than repeating it over and over again, maybe we ought to try something different. When we repeat the narcotic over and over again, we're probably going to run into more and more side effects with it rather than getting better and better pain relief. So then we're going to run into some nausea and some lightheadedness and other things that could be an adverse effect rather than being a good thing. So assess and reassess the patient's pain and consider alternatives. In addition to giving the patient pain medication, remember there's a lot of additional alternatives we can use, including relaxation, including bringing the family in and having the family present at the bedside to help the patient to relax and calm down. There's a lot of different pieces that we can add to this. So try to consider those additional alternatives. Comfort measures go a long way when a patient is having pain. Hot packs, heating pads, cold packs, etc. go a long way when a patient is having pain. If you want to read more about this particular study, you can find it in the Cochrane Library, Single-Dose Oral Analgesics for Acute Postoperative Pain in Adults by Dr. Moore and colleagues. I want to thank you for joining me today for the best postoperative pain relief. This is part of our 2-Minute EVB Challenge. Come join us online by going to edfornurses.com. Thanks again for joining me, and until next time, bye now.